My name is Joan Eakin, and I'm professor in the Dalla Lana School of Public Health and past director of the Centre for Critical Qualitative Health Research at the University of Toronto. Welcome to the CQ workshop series and to this brief introduction to what I call value-added qualitative analysis. My intent is to give you some idea for how to enhance the quality of your qualitative research. In this presentation, I will not be talking about the sorts of items you often see on quality assessment tools for qualitative research, the formal, standardized checklists for ensuring rigor of process and transparency. Instead, I shall try to nudge you towards more informal, non-standardized, and critical forms of analysis. In particular, I want to introduce two key concepts for enhancing quality. First, the creative presence of the researcher, and secondly, value-added analysis. Before starting, let me first clarify the kind of qualitative research I will be talking about. Much of what is called qualitative research is what I would call positivist qualitative research. The data are qualitative, but the analysis is positivist. That is, the data are analyzed using positivist scientific logic. This I distinguish from qualitative research that it is interpretive, where both the data and the analysis are qualitative. Within interpretive qualitative research, I distinguish, and I'm using today, a further variety, critical qualitative research. Critical analysis is an analytic posture that inquires into and takes into account received knowledge and the assumptions underlying surface data, the social forces influencing data, including power, the interests that are at stake in particular phenomena and situations. I cannot fully elaborate a critical approach today, but my hope is that you'll get a glimpse of what I'm getting at in this presentation, because that is the kind of qualitative research I'll be talking about. The dominant conception of research excellence is rooted in the notion of scientific method. If you execute the scientific process properly, i.e. you follow the correct procedures, your results will be true and valid. Procedures are standardized, objective, and hence reproducible, a key principle in conventional scientific research. Qualitative research is not achieved in this way. It is much less procedure-based. Procedures are used in qualitative research, but they tend not to be standardized, and there's no direct correspondence between a certain procedure and what comes from it. Procedures play a different role in the research process than they do in conventional research. In qualitative research, procedures are means rather than ends. So if the outcomes of qualitative research are not judged by procedural criteria, how are they to be judged? I would suggest that qualitative research be judged in terms of how well it achieves its maximum potential for producing certain kinds of knowledge. Speaking in particular about critical qualitative research at its maximum potential, I would see it that it would be able to problematize prevailing knowledge and underlying assumptions, interpret beneath the face meaning of things, conceptualize or theorize the data beyond the simple cataloging of known concepts, understand and explain phenomena mediated through human interaction and meaning-making, including social forces not directly observable, such as discourse and power. And integrate and situate, connect findings and generate a sense of the gestalt, the bigger picture that encases or explains findings. Easily said, but how is such potential realized? How do you actually do research that can problematize existing knowledge, interpret below the surface, integrate findings? None of these things occur in one stage of the research or in one place in a project. It is achieved throughout the whole research process. Since it's impossible for me to address everything in this short video, I will focus my remarks on the analysis and interpretation of data. What do you do with data once you have them? How do you analyze them? What sense do you make of them? How do you find findings? How do you conceptualize them? Of course, even within the topic of analysis and interpretation, I cannot go very far. So let me just mention 2 key strategies for productive analysis. In conventional positivist science, the researcher is seen as a hazard. He or she is full of biases that can ruin the objectivity necessary for legitimate scientific practice. Researchers must be absent from the research process. By contrast, in critical qualitative research, the researcher is a resource and needs to be present in the research. Even more outrageous to conventional science is the call in critical qualitative research for the researcher to be creatively engaged and interacting as an individual in the research. I call this creative presence. How does the creative presence of the researcher enhance research quality? The researcher deploys creative presence by actively as a research strategy. The researcher brings knowledge into the research and puts it to use as the research is being conducted. This doesn't sound so new, but most of us have been taught since elementary school that once the research has been designed, it is set largely in stone and the study is conducted exactly as originally conceived. This is not the case in critical qualitative research. I encounter students all the time who are frozen into keeping their studies very close to the original protocol, out of fear that change will invalidate their science. They find themselves with research questions that are no longer aligned with where their analyses are taking them, or they believe that they can only use data that they have formally declared as the data for the study, and that they cannot re-theorize their projects as something different than what they started out with. In critical qualitative research, it is not just okay for a project to evolve, but the researcher needs to embrace and actively participate in that evolution. That is the biggest strength of qualitative research. In fact, the point of qualitative research is to discover what the research questions should be, what is going on that wasn't known at the outset, what is important to focus on. To keep the project evolving and developing, the researcher should actively use everything at his or her disposal. First, include yourself as an object of inquiry, and then use what you learn. Actively and creatively use the knowledge that you have with you by way of your experience, knowledge, emotions, interests, ideas, prejudices, stakes. Don't just confess them and feel absolved. Put them to use. For example, you can ask, why am I surprised at this? Why is this not sounding as I anticipated? How have I prejudged this? And is that the way others I am studying also see things? Or, for example, long ago I did a study of stroke patients in a general hospital and how they were cared for by the staff. And I noticed, it was a participant observation study, and I noticed an unrealistic optimism, a denial of disability amongst the staff. And I noticed that the staff, in staff interactions with patients, how they always try to cheer up with chirpy, positive kind of talk. And I found myself doing the same thing. And I asked myself why, and used this insight to direct my investigation with others. More broadly, you need to be aware of your positionality. There are a million ways in which your attributes, your knowledge, your vested interests affect the research you do, the questions asked, the sense you make of data. The trick is to identify those that matter for the project at hand and focus on those, not on every characteristic imaginable, being a woman, being a nurse, being young or old, having personal negative experience around the topic or whatever. You need to think, why might that matter? In what way would it affect me as a researcher? Does it cloud certain issues, preclude certain questions I might ask, blind me to certain things, limit my conceptual reach? Understanding your own positionality is useful not just because it can open up new viewpoints on something, but because the awareness can actually point to important dimensions of the problem you are investigating. It can point to what is obscured from view or tell you something important about your object of inquiry. You also have to recognize and use knowledge of your standpoint and knowledge of whose side you are on. The question often offends people. So deeply ingrained is the notion that science is neutral and that you should strive to be so. But there is no neutral place from which to conduct research. So it is important to figure out where you stand implicitly or otherwise, and then to use that knowledge to further your analysis. I am not saying that you should let advocacy get muddled with science, only that you need to know your implicit position and recognize how it affects what you do as researchers. One of the classic taken-for-granted standpoints in our field is taking an administrative or managerialist stance, explicitly or otherwise trying to improve things, make more efficient or effective some service or other, bring about some social change. That is taken as given and is not seen as a position. Often expressed as offering the patient's perspective, but fundamentally the goals and interests are administrative, which represents ultimately a different standpoint from that of the patient. Acknowledging your standpoint is not enough. You then have to put it to use. You start by letting it help guide you in the progressive clarification of what it is that you are trying to understand, to explain. Zeroing in on specific core elements is often what happens in a project that starts off very broad and general. People think they start with the question, but in critical qualitative research, the point is to find what the question is that needs answering. For example, I did a study of a new Ontario government policy on return to work after work injury and illness. I was interested in seeing how it played out in small workplaces. Now, by the way, you can note that the difference in the standpoint and perspective of calling these entities small businesses, as it is done in the field as a whole, which conceives them as commercial enterprises, compared to small workplaces, which conceives them as places where people work. I called them workplaces because my standpoint was that of the work and the workers rather than that of management or the business entity. I included both employers and workers in my study, but I used the employer data in relation to what it had to say about workers. That is, I wanted to understand how the employers saw things so that I could use that understanding to better understand what the situation and the implications were for workers. Knowing my standpoint, what I wanted to most understand, directed my analysis and interpretation of the data. Creative presence is the use of yourself in research. It helps you to handle the problem of voice. Excellent research makes a clear distinction between the data and their interpretation and has to make it clear who is speaking. The subjects uttering the data or the researcher interpreting the data in particular ways and using them as evidence of an argument or being put forward. Not so good research tends to muddle voice, to not make it clear who is speaking in the text. Excellent qualitative research has a strong presence of the researcher, and it is clear what is analytic interpretation and what is not. Data do not speak for themselves. A further way in which creative presence operates to enhance the quality of qualitative research is through what I call value-added analysis. The notion of value-added refers to the fact that the data themselves do not have too much intrinsic value. It is the researcher who adds value to the research through interpreting and analyzing them, through assigning them meaning. All data are interpreted. What they are seen to represent, how they are assembled and reported, all are interpretations. Adding value implies moving beyond the straight summation of data taken at face value, the sorting of data or cataloging into categories that are drawn from what is already known before the study started. Concepts have embedded in them assumptions. They create rather than merely reflect the phenomenon. Language carries an implicit analysis in it, so the labels you use define the phenomenon you are addressing, as I just noted earlier with the terms small business versus small workplace. Pre-existing concepts largely predetermine what is seen and heard in the data. which can be an impediment to seeing fresh things in the data or to thinking about them in different ways. Adding value involves going beyond the search for themes. Themes are often seen as residing in the data, just waiting there to be found. Themes are not found, they are constructed. Consider, for example, the common use of the notion of barriers and facilitators as the basis for themes. Data from interviews, say, about the use of such and such a health service are often classified and coded according to whether they are barriers or facilitators, often on the basis of what the subjects of the research say in response to direct questions about why they do or don't do X or Y. The limitations of this approach is that the notion of barriers and facilitators frames the notion of use of services from the outset in a particular way. It presumes that participants would normally, rationally, reasonably, naturally want to comply or use a health service, and that if they don't, there must be something blocking them from doing so. And we then conceptualize these barriers using a pre-existing stock of knowledge about barriers, such as ignorance, lack of money, misaligned cultural beliefs. However, this is not the only way to conceptualize what is going on. Sometimes you can learn more by not presuming what the phenomenon of interest is before you start. Students are often surprised when I tell them that they have pre-theorized their data when they approach it from a barriers and facilitator perspective. They think they're doing exploratory work and are open to finding the factors affecting the behavior in question. But in fact, they often have closed down important alternative paths of investigation. Rather than just cataloging data in conventional categories, premium critical qualitative research engages reflexive or self-conscious reconceptualization of the data, constantly questioning the way things are conceived, the assumptions underlying them, and then generating novel theorizations of the data that bring new perspective on the phenomenon being studied. My point is not so much that using stock preconceived notions is bad, but more that it can prevent you from seeing it as something else, from getting a quite different analytic sightline on it, which is the special strength of critical qualitative research. Another important way to add value to a qualitative analysis is to make your concepts generalizable. And by this, I do not mean statistical generalizability. I mean analytic or theoretical generalizability. That is, the concepts and theory you build to explain something particular can be used to understand other like phenomena. But what are like phenomena? On what basis does one find similarity and hence the possibility for generalization? Good quality qualitative research aims to identify the key properties of the phenomena of interest, which enables the reader to judge if the findings are relevant to other phenomena with similar properties. Theorizing data progressively, conceptualizing in more abstract terms, is what allows findings to be transported beyond the particular study. Let me give you an example from one of my studies that was concerned with the problem of people injured at work, how they did or did not get back to work. In that study, something that I saw all over the data were references to workers feeling psychologically damaged by the experience of work injury, of being treated badly by their employers and other workers, and the public and the compensation system. I could have just cataloged all the things they told me about their experiences. They didn't feel believed. They thought people treated them as malingerers or as cheaters or as lazy and not wanting to work, and so on. I could have gone beyond this cataloging of how they themselves describe their own experiences and called it stigma and plugged it into a huge literature on stigma and disability and so on. That would be theorizing the data, assigning a more abstract label to the empirical local data, what they told me, their words, and their stories. I started there, but because I had interviewed employers and compensation board people as well, I saw that the idea of workers cheating the system was very widespread. So I began to develop the notion of a broader discourse of abuse and started to explore how that discourse was produced and maintained. And from there, I began to see that workers were implicated in generating that discourse themselves in various ways, including their own practices and interactions with others. I conceived their disability behavior as performance, arguing that workers constantly needed to perform their innocence, their honesty, the proof of their pain and suffering, and that this performance contributed to a whole cycle of interaction that accentuated the discourse of abuse and perpetuated their suffering. Seeing their behavior as performance helped me explain a lot of things they did and a lot of how other people responded to them. The concepts I used and the explanation I put forward were generalizable by virtue of the fact that I tried to bring out the more abstract, general issues at play: the tenuous legitimacy of accessing public monies, the concept of deservingness, norms around not working and getting something for free, sociological issues of malingering and the sick role, etc. The concept, the discourse of abuse, was born in my particular study of injured workers, but it can be applied in many other domains of inquiry. It is in this sense that a qualitative study can yield generalizable findings. In your own studies, you can begin to tease out the abstract things going on by asking yourself, what are these data instances of? It is a powerful thought exercise that can help move you towards more abstract theorization that can allow your findings to be transported above and beyond your own particular topics. But where do you find that abstraction? When you ask, what is this an instance of? Where do you go to find possible answers? Though I cannot go into this fully in this short lecture, I urge you to draw on three things in particular. First, maximize your own resources. Let go of preconceptions of what the phenomenon is you are studying. Allow yourself to imagine it as an example of something else. Draw on your considerable knowledge and experience as a person. Then use all sorts of data to inform your thinking. Everything is data is my favorite mantra. You don't have to stick with formal data. Use everything you see and hear. For example, when I was studying injured workers and their experience with the compensation system, I went to the compensation board buildings. There were two buildings. One was for the administration, and the other, the administration and policymakers, and the other was for dealing with workers, the adjudicators, adjudicating their claims, and so on. And when I went into the worker building, I was astounded to discover it was a militarized zone. Mistrust was built into the security system. There were bulletproof glass partitions. Workers were kept separate from the adjudicators, and they were searched before they went in. The entire place spoke, the physical organization of the place spoke to the very issue I was studying. That's an example of how you can use all sorts of data. That experience informed my study a great deal. Next, you can read widely in the social sciences to find ideas, far and wide, not just about your substantive topic, especially in relation to possibilities for theorizing as they arise and as your ideas begin to gel. One of my students, for example, is studying the injured workers' experience with the compensation system and has framed the problem in terms of moral identity. And there is a literature on moral identity that she can draw on to help her make sense of her data. In another study that I did of the frontline adjudicators at the compensation board and how they interacted with injured workers and made decisions about claims, I used the issue of discretion, an abstract notion that I found in sociology that helped inform the way I understood my particular problem. A final way of achieving value-added research and maximizing the reach and quality of critical qualitative research lies in using procedures as resources for enhancing understanding. As I said earlier, Use procedures not as ends, but as means. That is, use them as resources. In my own research, I use various procedures, which I call analytic devices, as a way of making sense of my data. Analytic devices are essentially procedures, things that you do with your data and that enable you and facilitate interpretation. The procedures themselves are not what matters. It is what the researcher does with them that matters. My notion of procedures is that their primary role is as a tool for seeing data, for adding value to the analysis. I can't go far with this today, but let me give you an example that you might be familiar with, member checking. In qualitative research, member checking is often advocated as a technique for verification, for demonstrating that what was put forward is true, is valid. Rather than using member checking as a verification procedure, which is problematic methodologically and philosophically in critical qualitative research, I would encourage you to use member checking and other forms of feedback on your research as a source of further data. What does the reaction of your participants to your interpretation of the data tell you? What does agreement or disagreement mean? How can you understand and explain their reaction? And how does it inform your ongoing analysis? For example, why do people deny certain things? How do they want to be represented? What is at stake for them in appearing in certain ways? Posing such questions of member-checking data can give you important analytic insight. For example, in that study of work injury and compensation that I mentioned earlier, where the concept of the discourse of abuse became a key concept, when I told the workers involved in the study about my interpretation and the concept of them being pushed by the discourse of abuse to perform their disability, which in turn implicated them in their own oppression, if I had used member checking as a tool for determining validity, I might have taken their reaction, perplexed, resistant, incredulous, and concluded the concept was not accurate. Instead, I used their reaction as more data to be used in the analysis. Their reaction helped me to see the kinds of stakes they had in making their suffering visible, the functions of blaming an external enemy and villainizing the compensation board as an institution. And this, in turn, showed me how this positioning was built into the injured workers' social movement and their mode of survival. Thus, taking the ideas to the participants was not a procedure I did to gain legitimacy or stamp of approval, but as part of an analytic strategy for further development of the conceptual and explanatory framework of the study. There are many standard procedures in qualitative research that can be used in this way: constant comparison, negative case analysis, cross-case summaries, and so on. They do not in themselves produce fixed analytic outcomes, but used as resources, they can produce new data. I recommend highly to you the book by Howard Becker called Tricks of the Trade for mental exercises that can help you make sense and make more abstract your data. Thus, ultimately what emerges is not a function of the strategies themselves. The procedures are just tools for enabling the researcher's insight, imagination, and creativity. Here we get back to the notion again of creative presence, the importance of you, the researcher, being fully present and active in the research process. Critical qualitative research is indeed subjective in the sense that it is ultimately constituted by what the researcher brings together in the exercise. And in the end, what is put forward is one interpretation of how the data might be understood. What you are aiming for as the researcher is to put forward a convincing, credible argument for your interpretation of the data, for your characterization of what is going on and what is worth understanding. There is never just one right story in your data. You as a researcher aim to put forward a strong, convincing, defensible one. So to bring this talk to a close, I have been making a call for maximizing the quality and potential of qualitative forms of inquiry and urging a research practice that is capable of questioning prevailing knowledge and of generating new generalizable conceptualizations. To do this, I have proposed 3 things that you can do. You can adopt a critical posture towards the research process by looking beneath the surface of things, questioning received knowledge, being attentive to whose interests are at stake. You can exploit fully the creative presence of the researcher by not removing the researcher from the science, but by inserting him or her vigorously into it. You can engage in value-added forms of analysis by drawing on your own experience, exploiting your positionality, treating everything as data, and by using procedures not as ends but as means to insight and theory generation. A little postscript. First, don't get me wrongly. By saying that one needs to go beyond standardized checklist notions of quality to more non-standardized and idiosyncratic practices, I am not suggesting that anything goes or that you can just make up an interesting yarn. I would argue that rigor is required in all research. That is what makes it research and not fiction or journalism. Rigor is defined in the dictionary as being diligence and attention to methodology. In positivist research, rigor refers to stringent adherence to the rules of method in order to guarantee the truth and validity of results. In critical qualitative research, rigor refers to stringency in interpretive qualitative thinking and reflexive interpretation. Secondly, such a form of analysis may be worrisome to many because certainly among students, but also among seasoned researchers, there is security in thinking that there is a clear road to scientific knowledge, a certain way to get there if one just follows the rules, uses the correct procedures. But to produce value-added qualitative research, you have to be able to handle non-standardized process, an unfolding process of discovery and sense-making. With experience and growing skill, you will be able to deal with the inherent uncertainty of qualitative analysis, and you'll learn how to find analytic grasp. There is no doubt that it requires hard conceptual labor to do this kind of research. But what will keep you at it is the joy and excitement and never-ending intrigue of going beneath the surface of things, thinking against the grain, discovering what the question really is, making sense of things that didn't used to make sense, and creating new insight and knowledge. These are very big returns on the work of critical qualitative research.